I'm John Craig, President and CEO of Elite TeleHealth Consulting. If I live in Longview and my mother lives in Dallas, 2 hours away, when I call to check on her and she says she doesn't feel well, what does that mean? Does that mean I need to drive 2 hours to check on her? Does that mean she needs to see a doctor? What does that mean? Elite TeleHealth Consulting works with clients like my mother to manage health and chronic disease. We place a FDA Class II device in our client's home. It takes 3 to 5 minutes to record the client's vital signs: blood pressure, heart rate, oxygen saturation, and weights every day. The vitals are then transmitted to our central station, where we have a licensed nurse that evaluates the health of the client. If you suffer from heart failure, chronic obstructive pulmonary disease, diabetes, hypertension, or other chronic diseases, then listen. Elite prevents and/or dramatically reduces doctor visits, emergency room visits, hospitalizations, and exacerbations, or events that require medical attention. Vital signs are what we use to measure health. They tell us if we're trending to an illness. They tell us if we're healthy. I'll give you an example of how and why telemonitoring works. Let's say we have a client with heart failure, congestive heart failure. Fluid retention is dangerous. Say the client gains 2 pounds on Monday, then he gains another 2 pounds on Tuesday. That equals 4 pounds. When he lies down, that fluid surrounds his heart, making it work harder. Symptoms like shortness of breath, fatigue, and elevated blood pressure present. This could result in exacerbation or events that require medical attention, emergency room visits, hospitalizations, and sometimes even death. What if you could change the course of an illness? Elite TeleHealth can track and trend your vitals to create an environment of prevention. Use the same example utilizing Elite TeleHealth. When the client gains 2 pounds, we know it immediately and it results in action. Our nurse is going to use structured telephone support and call the client and/or the family or caregiver to make recommendations to get the weight off. The nurse is going to educate medication compliance and diet changes and prevent negative symptoms. Structured telephone support is paramount. Ask the right questions and we're able to paint a picture of what caused the alert. Whether it be a diet choice, a missed medication, we'll identify triggers that caused the alert. Let's talk about benefits. How about a client who's not stressed, who is educated about their disease, who's educated to be diet compliant? We can reduce fear and anxiety knowing that a licensed clinician is monitoring you or your loved one's health 7 days a week. We can reduce symptoms to feel better and remain independent. Gain compliance with medication. We can reduce families' time off from work, having to go through the revolving door of the emergency room and hospital, caring and supporting their loved ones. Reduce travel expenses, ambulance fare, the cost of new medications and therapies. There's also benefits associated with families that do not live near their loved ones. Back to my mother. What does "I don't feel well" mean? Utilizing Elite TeleHealth, I have comfort knowing that a nurse can validate the level of "I don't feel well." I have peace of mind knowing that a nurse has been in contact with Mom each and every day, so that when "I don't feel well" requires medical attention, I can plan accordingly. Without the monitor, I would have a 2-hour drive worrying about what may or may not be wrong. Through telemonitoring, you can feel better. You can be healthier and independent. As a home care advocate, my favorite benefit is that you can age in place in your own home and extend your independence and feel better. So here's a question. Are you okay? If you would like, Elite Telehealth can tell you if you're okay, giving you and your family peace of mind. If you would like to learn how Elite Telehealth can prevent and/or dramatically reduce emergency room visits, hospitalizations, how we can prevent or dramatically reduce events that require medical attention, how we can manage the fear and anxiety that comes with managing chronic disease, then I hope that you would contact Elite today. Thank you for taking time to learn about this tested and proven service. Please contact us today to learn how you can age in place in your own home and extend your independence and feel better.